Let's talk about this new research that shed light on the possible causes of chronic fatigue syndrome, also known as ME. Scientists from King's College London believe the condition in which sufferers experience extreme tiredness is linked to an overactive immune system. Well, we can speak to Professor Carmina Pariante, who's a Professor of Biological Psychiatry at King's College London. And John Peters is with us. John's from Swansea and has had ME since 1985. Good evening to both of you.
Good evening, Natalie.
Good evening. Hi, Professor Pariante, let's start with you if we can. The significance of what you found, I think it's always thought of, at least by perhaps people who don't know that much about the illness, that this is a bit of a mystery illness. Is this part of the reason why you're doing this research into ME?
Yes, absolutely. And one of the problems with the research in chronic fatigue syndrome or ME is that the patient comes to the attention of the doctors or in fact of the research community when they've been ill for many years, 5, 6, 10 years. And so by that time, when you try to understand what happened early on in the history of the illness, around the time that the illness started, it's very difficult to draw a conclusion about what caused the illness in the first place.
Okay, we'll come back to you in a moment because there's a couple of problems with the lines. We'll try and sort that out. And John will ask you whether, if that is perhaps how it happened for you. Were you experiencing symptoms for a while before you got any sort of diagnosis?
No, not really. My illness is not a mystery, in fact, that I got a virus and I know when, where and from whom I picked it up. And then I ignored it for 3 weeks. It was about this time of year, in fact, in 1985. And I just tried to run it out of me. I was a young man and a student, and it was the last week of term. There were a lot of parties. And when I wasn't drinking, I was running it hard on the track. And that activity, combined with the virus, produced ME. And although in the early part of 1986, there was some difficulty in diagnosing exactly what the problem was, and they thought it was just a virus. Eventually they said, well, yes, because of this virus and because of the activity, you have what was then called post-viral syndrome, and that is ME. If I could just correct one thing, the main symptom isn't so much fatigue as post-exertional malaise, so that although people may look normal and they may be sitting around and seem normal, if they indulge in any activity, whether physical or mental, and in my case it's primarily mental, then after that activity, then we feel ill. And it's when we're doing the activity, we're not normally aware of it. We don't feel bad all the time when doing the activity, but then it comes back to us afterwards. So some people could be fine, and then 24, 48 hours, they'd be feeling very ill indeed. So it's not primarily about fatigue. And there are a lot of other factors involved as well, so that it's been recognized as a neurological illness by the World Health Organization since 1969. That this idea that it's sort of a recent illness is just false. And the symptoms then range across the neurological, the endocrinological. It's a multi-systemic illness, and not just about fatigue.
Okay. Well, let's bring Professor Pariante back in. John's an interesting case then, because he feels, well, a sort of an event triggered this, and this actually, I think, perhaps links into your research. Just explain a bit about what you've been looking into.
Yes, I think actually that experience, that personal experience that we just heard, links perfectly into the research that we've done, because we've been able to use a group of people that have a high risk of developing chronic fatigue syndrome, in this case following an activation of the immune system through a medication that they take for therapeutic purpose. But in reality, it's very similar to what happened to many patients at the time in which they have a very strong viral infection. And what our research shows is that people who go on to develop chronic fatigue syndrome later on have a hyperactive immune system already even before encountering this immune challenge. So it's part of their, if you like, the genetic or personal makeup. And then when they encounter the immune activation, let's say, for example, a virus infection, as we just discussed, then their immune system responds even more. And the uniqueness of our study is that we have been able to study people at this early stage of the illness, at a time where, as we just heard, the symptoms can be confused just kind of as part of the normal infection process, and so people would not normally be involved in research.
Well, what does it mean then in practice? Obviously, it's early stages, but is it the type of thing now, eventually there may be some sort of screening process?
Well, I think it's twofold. So first of all, and again, as we just heard, and I totally agree that chronic fatigue syndrome (ME) should be considered as a multi-system disorders where many organs are involved. So we don't know what does this increased immune activity early on does to the rest of the body, the brain, the muscles, the liver, other cells in the body. And which then creates the fatigue and the post-exertion malaise, which remains long-lasting. So the first thing is to try to understand what is downstream of this increased activity of the immune system.
I wonder if I could ask the professor something, to clarify something, that we're not certain that these people in the study do in fact have ME or chronic fatigue treatment, are we? Because they're not actually ME patients, but people who have fatigue after interferon-alpha. Is that correct?
They have chronic fatigue 6 months after stopping interferon-alpha. So their qualitative experience is very similar to the experience of patients with chronic fatigue, including the fact that they no longer have an immune activation by the time they have this chronic fatigue.
But there is not, for example, post-exertional malaise, and you can't actually say for sure that these people have ME. But I do think it is interesting that somebody is having an illness and there's no obvious biomarker, and that perhaps could be seen as similar to those people with ME. Is that correct?
Absolutely. And, this for us, this is some kind of light in the fog, it's a direction of travel for research. It's not a conclusive study.
Yeah, I mean, John, sorry, we haven't got much time, John. Sorry to
but it's an important point. You could confirm that there are no psychosocial factors in who develops a chronic fatigue. Is that correct?
In this study, we found a clear distinction between, for example, depression or other aspect of mental disorders and the patient that develop chronic fatigue.
Okay, John, I just do want to come back to you. I suppose, I'm just interested in how you feel about this type of research going on, because obviously it's not going to help you in the stage of your illness, but I suppose it certainly could help people at the initial stages. Do you welcome it?
Well, yes. Any research into the biological nature of ME is very welcome. Though I should point out that there's a lot of this going on. For example, there was a study in the United States last week by, I think it was Younger, and they found areas of inflammation in the brain. So it's not new to find biological changes in patients with ME. It's something we've known about for decades. It's kind of overlooked. But I do certainly welcome this. It does show that people who have an immunological stimulus can have a long-term serious illness characterized by fatigue, for example.
And I suppose that adds to understanding of the condition.
Perhaps not of the condition, but of an area to look at, to investigate, yeah.
OK. Good to talk to you both. Thank you so much. John Peters there, we heard from who has had ME since 1985, and Professor Carmine Parienta from King's College London.